There are 3 points of adjustment for an Adams clasp. The first point is right where the crossover wire exits the acrylic. The second is the arrow point. And the third is the bridge wire that connects the arrow points. To adjust the crossover wires, grasp the appliance on the acrylic area and hold it stable. Then take your other hand and simply flex the wires downward so that both crossover wires flex down at the same time. This will flatten the crossover wires down into the embrasures. You may also use a 139 bird beak plier to make this adjustment. Use caution because it focuses the forces on one specific spot and you could fracture the acrylic at the junction. To make the adjustment, hold the appliance between your thumb and your forefinger as before and grab the wire as close to the acrylic as possible with the bird beak pliers. Lightly and gently rotate the wire downward. Next, we will adjust the arrow point. The arrowhead is the retentive part of the clasp. It engages the mesial and distal undercut. The point of adjustment is in this V-bend. The adjustment can be made with a pair of 139 bird beak pliers, placing the round portion on the inside of the radius, and a slight rotation toward the gingiva on both sides will make the adjustment. The third point of adjustment is on the bridge and the exiting portion of the wire from the arrow point. To make this adjustment, grab the under portion and simply turn it inward. This adjustment will cause the arrowhead to engage the undercut more tightly. Now let's talk about what people tend to do wrong on this adjustment. First, because they want to engage the mesial distal undercut, they grab on the bridge with a 3-prong plier. Even though this is a common method taught to adjust the Adams clasp, it creates an undue stress in the crossover wires that will initiate a fracture where the wire exits the acrylic and will lessen the life of the clasp. Another common mistake is to use a 3-prong plier on one of the crossover wires, in an effort to get the wire to be tucked in more tightly in between the teeth. We highly recommend that you don't use this technique, as it too creates an undue stress in the wire and will cause it to fail. Simply using hand pressure as shown earlier is the best method to adjust this clasp.